Thank you, Matt, for allowing me to participate in this Protect Our Care press virtual conference. And my colleague Judy Chu, who does an excellent job on behalf of not only the people of her own congressional district, but within the Democratic caucus here in Washington. And I think she did a good job in outlining the challenges, not only in her district, but that we feel in mine and districts across the country as well. Uh, I don't want to repeat all of the numbers that Judy highlighted, but there is over $1.3 trillion in cuts over the next 10 years to Medicaid, SNAP, and the tax credits under the Affordable Care Act. And at the same time, adding over $4 trillion in debt. And I thought, our colleagues on the other side used to be a party of fiscal discipline. They're clearly not. And I think the impacts of this, what I would call Republican healthcare crisis, is just beginning to be felt with premiums going up, open enrollment getting ready to close. The fact of the matter is that the Republicans, as Judy noted, from 2010 until recently, have attempted to overthrow the Affordable Care Act, not 22, not 43, not 52, but over 70 times. 70 times I voted no, with nothing to replace it with. If you had a better idea, if you wanted to come up with another proposal, certainly the Affordable Care Act is not perfect, and the things that we can and should be doing, and is really part of a bipartisan effort right now to restore the ACA tax credits for the next 3 years. But in my former congressional district, when I voted on it in 2010, over 24% of my constituents had no health care insurance whatsoever, and 17% were underinsured. That's from Merced County, the Flatland of Madera County, and Fresno, most of Fresno County. My district has changed since reapportionment. But 10 years later, after the passage of the Affordable Care Act, that number from 24% dropped to 10%. That's a big change. And the underinsured improved as well. And, we never mentioned the $8 billion that was set aside for federally qualified healthcare clinics that in rural America especially, and I represent a lot of rural parts of the San Joaquin Valley, really improved the access to healthcare in areas where you're, 40 minutes, an hour and a half away from a hospital. So that is very important as well. And I think the other factor needs to be put on the table, and that's the impacts to our healthcare facilities, our hospitals, and our clinics as a result of the Medicaid cuts. We're looking in Fresno. The community medical center is the second, believe it or not, second largest hospital in California, and one of only 5 that has both trauma center and burn units. And they have the highest ER utilization, the emergency room utilization of any hospital in California. And so whether it's whether it's the Central Valley Children's Hospital, 76% of their patients are Medicaid. I mean, think about that. Cahuilla, Adventist Healthcare. And so this directly impacts your access to affordable healthcare. And not to mention the challenges it will be and the economic impacts, the ripple effect by what is being proposed here to be implemented. So this is a crisis that our Republicans colleagues have created, and I think we're just now beginning to feel the impacts of 22 million American families being impacted as a result of the repeal of the ACA. And in my district, it happens to be over 24,000 families. So this is important, critical access to healthcare And the safety net that we've relied on basically over the recent decades has been now, I think, sadly degraded. And so we're trying to see if there is any desire among the 17 Republicans and others to work on a bipartisan basis to restore those tax credits for the ACA. And we're trying to figure out. I had a workshop with all my healthcare facilities last fall, the major hospitals and healthcare clinics. We're going to have another one here in February to tell me what the economic impacts are going to be to their healthcare facilities, to the access of healthcare that they provide my constituents, and at the same time try to determine how we're going to keep these facilities operational. I mean, because some of them people don't realize. Madera Hospital I used to represent, it closed. It was closed for almost 2 years. We've reopened it. It doesn't have the quite level of care it had before it closed. But there are many healthcare facilities like that, not only in California, but around the country, that are in real financial difficulty. So I'll close there, but I mean, the impacts of the costs that Representative Hsu outlined are very similar in my congressional district as well. And I think that, as Democrats, we're continued to focusing on lowering healthcare costs for families, and also trying to bring down the soaring costs that we see and other issues that Californians care about, whether it's the affordability of homes or cars or their utility bills or just the challenges in putting food on America's dinner table. All of these are factors, and I'd be happy to respond to any questions that members of the press who are participating in this virtual conference may have. Thank you again, Matt, for allowing us to participate.
Yeah.